The leaders of hospitals throughout the metro say the COVID Delta surge is maxing out their healthcare systems. As KMBC9's Michael Mahoney reports, it's also having a big impact on treating other patients, too.
This is coming from a set of chief medical officers of hospitals big and small around the metro. They are comparing the latest surge to last winter's peak.
Where we're being compromised is our ability to take care of not just COVID patients, but every patient, right? That's the ultimate problem.
Their evidence, the 7-day average of new COVID cases is higher now than in November, just before the winter peak.
Our emergency rooms are really suffering. They're overwhelmed.
St. Luke's chief, Dr. William Gilbert. Elizabeth Long of Olathe South talking about the right end of this hospitalization chart.
These are daily new hospitalizations, so that doesn't count the patients that are already in the hospital.
Dr. Steve Seitz, the chief medical officer at KU.
We had 3,000 COVID patients. We haven't had in-hospital transmission of COVID. Why is that? We're masked. Right? Masking works.
The chiefs came back to that repeatedly. Getting as many as possible wearing a mask is a short-term solution to the surge.
The Delta variant is twice as infectious as previous versions, and it's spreading rapidly in Kansas.
That's a new TV commercial from the state urging people to get vaccinated. And beyond the medical crisis, and they used that word, the head of the Chamber of Commerce says businesses are now facing another uncertain period.
Many have exhausted their relief efforts, and understandably, business owners are worried about what's coming next.
The doctors made no public policy recommendations, but obviously support the indoor mask mandates in place in some parts of the metro. Michael Mahoney, KMBC 9 News.
And according to the Mid-America Regional Council, 45% of the 2 million people who live in the Kansas City area are now fully vaccinated. Johnson County, Kansas still leads the way with over 50% of those eligible vaccinated. Clay County is at 42%, Jackson County, Kansas City, Missouri at 40%, Wyandotte County, KCK at almost 36%, and Cass County nearing 34%. All right, less than 12 hours now until the country music superstar Garth Brooks performs here in Kansas City. Some 70,000 fans are expected to attend tonight's show at Arrowhead Stadium. And local doctors say they'll be watching to see what happens. Masks will be required inside all the indoor spaces at the stadium, but not outside. Garth encouraged people yesterday to wear a mask. Doctors with the University of Kansas Health System say that's a good idea for certain groups of people.
I think if anyone is out at that game or out at that concert who's not vaccinated, and especially if you're not vaccinated and you have underlying health problems, man, I'd keep my mask on indoors or outdoors.
Doctors say if you're going to the show, keep a mask on outside, especially if you're around people that are singing. If someone has the virus, shouting or singing can easily spread those infected air droplets. A reminder, if you are going to the concert tonight and you're unvaccinated, you can get vaccinated ahead of time and you could win a better seat. The Kansas City, Missouri Health Department will be giving out COVID vaccines in the Arrowhead parking lot today from 3 to 7. Anybody who gets this shot will be entered into a drawing to win premium floor seats right up front. COVID cases just keep rising at Children's Mercy Hospital, where 19 kids are now being treated for the virus. KMBC9's Kelly Eckerman talked to an infectious disease doctor about her greatest concerns and what she wants parents to know right now.
Based on what local doctors are seeing, it is not time to let your guard down when it comes to children and COVID-19.
We have children in our intensive care units right now who have never been hospitalized before. They have no previous medical conditions. And we're seeing that they are also getting hospitalized with COVID-19. We're seeing children present with cough, shortness of breath, and difficulty breathing. And unfortunately, many of these children are requiring additional assistance to help them breathe.
COVID patients at Children's Mercy range in age from infants to teens. Doctors say mitigation strategies like masking and good hygiene have worked in limiting severe outbreaks among children. But things have changed from a year ago. The Delta variant is now dominant and spreads more easily. And while we now have a vaccine, young children are not eligible. That's why doctors recommend everyone around them get vaccinated.
What I want parents to know is that COVID-19 can absolutely make children sick. Unfortunately, COVID-19 can put previously healthy children in the hospital with severe disease, and that we have mitigation strategies that work.
Kelly Eckerman, KMBC 9 News.
And Dr. Schuster anticipates that 5 to 11-year-olds will be the next group of kids eligible for a vaccine, and that could happen sometime as early as this upcoming school year. Last month, there were 506 cases of children under the age of 11 catching COVID-19 in southwest Missouri. That's according to the Springfield-Greene County Health Department. That's twice as many cases in June. And last December, there were 255 cases of kids catching COVID there. Students and staff at K-State will now need to wear a mask starting on Monday. That new mask mandate will require everyone to wear one inside on university property. KU made that decision based on CDC guidance. K-State, Mizzou, and UMKC all began requiring students and staff to wear masks indoors.